This video is based on research conducted by the Universities of Liverpool and Lincoln, funded by Dunhill Medical Trust. The following story is fictional, but is based on interviews with residents, families, carers and managers in care homes. Meet Peter. Peter's best friend is his dog, Rex. After Peter's wife died, he and Rex lived in their own home for many years. Carers came in during the day to help Peter and Rex out. But despite the carers' help, Peter began finding it harder to cope. He would forget important things like shopping and medication, and was getting muddled about the time of day. He was also finding it hard to move around at home safely. Peter was worried that if he asked for help, he might be separated from Rex, so he kept trying to manage by himself. One night, Peter had a fall. In hospital, Peter was advised he wasn't well enough to go home. Peter's social worker understood that staying with Rex was really important to him. She and Peter agreed that while he was in hospital, Rex would stay with Peter's nephew, Luke. Luckily, the social worker knew that a nearby care home allowed pets to live in the home. This isn't always the case, and older people and their families can find it hard to access information about pet-friendly homes. The care home manager visited Peter and spoke to him about his needs. They also discussed things Rex needed, like a healthy diet and regular walks. They also considered what other people in the care home might need. Some people might not like dogs, or might be at risk of tripping over Rex. They agreed that this could be managed by keeping Rex out of some parts of the care home. They discussed people who might be able to help. Peter's nephew Luke could drive Rex to the vets for vaccinations and health checks. And a charity offered help to find a volunteer dog walker. They also talked about what might happen in the future, such as if Peter became too ill to keep Rex with him. They agreed that if that happened, Rex would live with Luke. Once everything had been agreed, they wrote it down and stored it with Peter's care plan. In the home, Peter's lead care worker is Amal, who loves dogs. She regularly asks Peter how things are going and whether he and Rex have everything they need. Peter says he and Rex are very happy. He feels free to share suggestions for how to make things even better, and Amal includes this in her notes. What can help older adults like Peter stay with their pets? Recognizing the importance of pets for older people. Care homes clearly explaining and publicizing their policy on pets. Asking about pets at assessment and explaining necessary steps to ensure animal welfare. Good planning that thinks about changing circumstances such as declining health for both person and animal. Team working and creative thinking to address the needs of older people and their pets. Considering people who have less support, like those without family to help. For more information and advice on this issue, please visit the following link.